am so tired. If this sounds like you, well, be sure to watch on, because in today's episode of Dr. Nora, I go through the commonest reasons for why you may be feeling tired all the time and what we look out for as doctors and how you can help yourself to feel better. It is believed that 1.5% of consultations that present to the family doctor or the general practitioner all surround the feeling of tired or feeling fatigued. But what does this actually mean? Well, let's take a closer look. When somebody is feeling tired or fatigued, they may feel like they've lost their ambition, they've lost their motivation, they feel sleepy despite having a long period of time sleeping, rather like my friend Scully over here, or they may just feel drained and no energy. But there are certain things that we look out for as general practitioners to find out whether the reasons you're feeling tired are for more simplistic reasons or they're more serious reasons. So let's take a look at those symptoms together. Some of you might come into the doctor and you say, Doc, I am feeling so exhausted. Even though I have my fruit, my fibre, my broccoli every day, I still feel really tired. Surely there must be something wrong with me. Or it may be that you're presenting to the doctor even though you're sleeping 8 hours a day, solid like a rock, but you still feel tired. And there are certain symptoms that we look for as doctors that kind of will elicit any sort of red flag symptoms. And they'd be questions along the lines of, well, are you bleeding? Are you bleeding abnormally? For example, if you're a lady who's experiencing periods, what are your periods like? Are they particularly heavy compared to, say, an average person? Because if your periods are super heavy, you might be experiencing some iron deficiency, and that may be the contributing cause of your tiredness. But conversely from that, if you don't experience periods and you're still feeling tired and your iron is low, then we need to find out, why is your iron low? Why is it that you're not able to keep up your iron intake? Is it because purely dietary sources, or is there some internal bleeding going on inside that is causing you to feel tired? Because let's face it, if our iron is low, we do feel really tired and lethargic. We also, if our iron is low, we feel a little bit of shortness of breath. We might experience some heart palpitations. Maybe our hair will be getting thinner. Maybe our skin will be quite dry as well. So there's a whole load of symptoms that can go with an iron deficiency. Other questions that we may ask you is whether or not you've had any recent weight loss. Now, good for you if you've been hitting the gym 5 days a week and you're trimming down for summer, well done you. But if you're somebody who isn't doing anything and you're simply just shedding off the pounds, we need to know, why is it that you're shedding off the pounds? Because sometimes it could be a reason that may not be a very healthy reason, and sometimes it may be a sign of a cancer. So it's really important that we find out from yourself and with your medical doctor what it is that's causing you to feel tired, because if there is something sinister lurking, then that can cause you to feel tired as well. Other symptoms that we may ask you about is whether or not you're experiencing fevers, if you're feeling hot or sweaty, if you're feeling short of breath, and whether you're an older person and who's recently experienced a new onset of tiredness. This may also bring up some red flags in our mind to think, is there something else going on here? So it's super important when you do present to your doctor with feelings of tired all the time, you have to think about how long it is that you've been feeling tired for. What is your diet like? What is your appetite like? Are you losing weight? Are you gaining weight? Because conversely, if you're gaining weight and you're feeling tired, that may help us to diagnose, for example, a thyroid problem, which is the gland that sits in our neck over here, which is responsible for our metabolism. So there's a lot of symptoms that can go around feeling tired all the time, and it may not just simply be, you know what, I'm going to sleep and I'm just feeling tired. So how do we categorize you as medical doctors? Let's take a little look. As you can see on my flip chart over here, we can have a look at the possible causes of tiredness. And first up, common things are common. Luckily, as a general practitioner, a lot of my patients that come in with feeling tired will often fall into this category. And these ones aren't as sinister as, say, some of these ones over here. So what do I mean by common? Well, sometimes if you've just had a recent viral infection, we often know that there's a bit of a lag for your body to get better. And so we ask you if you've had a virus recently or any sort of infection, because we know that there can be a post-viral fatigue, which means that you're feeling tired because your body is still recovering over its illness. Similarly, if you're feeling quite stressed or anxious, that can also contribute to you feeling tired as well. In other cases, it may be due to a sleep disorder, much like my friend over here, Scully, who's having a bit of difficulty sleeping at night time. He's not able to shut his eyes and turn off his brain and fall asleep. And very often that can be the commonest reason as to why you might be feeling tired, because if you don't get that deep sleep every night, you'll certainly wake up feeling unrefreshed. Conversely from there, people who may be suffering mood disturbances may also be experiencing tiredness. And you'll find that if you do approach your medical doctor, they may quiz you a little bit about your mood and find out if there is any underlying anxiety or depression, because sometimes that can lead to you feeling tired. So as a general practitioner, I do often get patients who will present to me and they'll say, I've been feeling really tired, but everything's going great. But if we start to tweak in a little bit and ask them about their social situation, ask them about how things are going at work or at home, they then sort of start to realise and think, well, actually, you know what, I have been feeling really stressed, and actually my neighbour did do something horrible to me the other day, so maybe I am a bit down about it. And so it's really important to think a little bit more laterally. Even if your doctor does suggest something to you that you think isn't really appropriate, it's worthwhile just having a think about it and thinking, is that me or is there something else going on? Because once we do find out if there is a mood disturbance, there is plenty of help out there. For example, going from a psychologist all the way through to medication if you need to. Now let's talk about the more serious causes of feeling tired all the time. These are the things that doctors definitely do not want to miss. And they do go back to my previous symptoms that I spoke about, which are your red flag symptoms. Obviously, the scariest one out there that no doctor wants to miss in their entire life is the C word. We know that people who are suffering from a malignancy or cancer may feel tired, and it's super important that your doctor approaches you sensitively and asks you those red flag questions to find out whether or not you are one of those people who may be at risk or who has sadly got a malignancy that needs to be acted on ASAP. Other serious conditions that we don't want to miss as doctors include things like bacterial infections. For example, if you are having a super bad bacterial infection or any infection that needs to be treated ASAP as well. Any sort of infection will have its toll on your body, and it will naturally make you feel fatigued because your immune system is trying to fight it off. And so it's super important to let your doctor know if you are experiencing any symptoms of any fevers, if you're feeling a bit short of breath, if you are having any aches or pains, because that does help to direct the diagnosis through. Other people that we don't want to miss are those who may be experiencing anemias. For example, those people who are having heavy bleeding and it's causing an iron deficiency. And so you'll hear about iron deficiency anemias. Commonly this is in heavy menstruating women, but it can be in other people as well. For example, those who aren't eating enough iron in their diet. Other types of anemias and other types of deficiencies that we don't want to miss as doctors are other vitamin deficiencies. Those of you who may be deficient in B12 or vitamin D can also feel tired as well. And just as a tip for you guys, vitamin B12 is found in our dark green leafy veg and our red meat as well. And vitamin D is found in our eggs, fish and sunshine. But if you want to find out more about food for your immune system, then make sure you have a look at the link in the description below for another in-depth video about that, all about the food and diet. What other illnesses do we not want to miss? Well, we don't want to miss any immunodeficiencies. For example, any HIV or AIDS, because if we do miss this, well then we're obviously missing the opportunity to treat you if that is the case. Okay, so we've spoken about the common reasons, we've spoken about the serious ones, but what are the common pitfalls as a general practitioner? Well, I'll tell you a story. I had a young girl, very, very young, maybe 6 years old, and she was presenting with her mother and she was feeling tired, and she had seen maybe about 3 or 4 different doctors, and every doctor would do their workup and they would ask the child, what's wrong, etc. And they did a set of blood tests, including the iron, the thyroid function, to see if there was any deficiency. And everything would always come back as being normal. And the mum was really perplexed, and she was thinking, what is wrong with my child? Because in addition to this, the child was also experiencing some rashes on the skin and also some stomach upset with some diarrhea, but nobody had worked out what was going on. And so the mum, she came to me for a second opinion. And so thinking a bit more laterally and going through the history with the mum and the child and looking at all of the blood tests that had been done, I realised that potentially there could be a diagnosis of celiac disease that was not being diagnosed. And so I sent this beautiful young child off for a celiac disease testing, and lo and behold, it came back as being positive. And this was such a groundbreaking moment for the mum, because as soon as she stopped giving the child gluten, which is essentially, celiac disease essentially is a gluten intolerance, and people who have it can't eat gluten. As soon as she had stopped giving the child gluten, the child just immediately bounced back. She had no more rashes on her skin, there was no more stomach upset, her energy levels were just super bright, and the mum was so appreciative that nobody had worked out what it was, except for when she came to me, it ended up being a celiac disease diagnosis. And so it takes a little bit of patience and a little bit of lateral thinking and things that we really don't want to miss, because if we miss something like celiac disease, 1, it can have a debilitating effect on the child's life or the person's life, and 2, it can lead to further complications in the future. And so by being able to think about Other things that could be causing your tiredness will also help your doctor as well. So for yourselves, it might be worthwhile just thinking about any kind of dietary triggers that could be causing you to feel tired too. Other common pitfalls, girls, I'm talking to you. Yes, I'm talking to you right now. Pregnancy. Pregnancy is also a very common reason as to why you might be feeling tired, and I've had certainly my fair share of girls coming in not knowing they were pregnant and saying, "Doctor, I am so tired, I don't know what is going on." And invariably I will talk to them about their periods and I'll say, you know, what are your periods like? When was the last period? And then, oh, my period is late. And so then we'll do a pregnancy test and lo and behold, they will be pregnant. And of course, by making sure that all the rest of their bloods are normal, usually we can put it down to pregnancy fatigue. Other common pitfalls that we don't want to miss with yourselves and as general practitioners is metabolic disturbances. And I kind of touched on this a little bit earlier, but this means that disorders that can affect your metabolism. And so your thyroid gland, for example, which sits over here in your neck, is responsible for your metabolism. If your thyroid is overactive, you might experience things like weight loss, or you're feeling hot all the time, or you might be feeling sweaty, you might even have a bit of a tremor. Or conversely, if your thyroid is underactive, you might be feeling tired and lethargic, you might be putting on weight, you might have brittle hair and dry skin and feel really cold. So it's super important to think about these symptoms as well when you are presenting it to the doctor, because it might just help you to make that diagnosis to why you're feeling tired. And not only do we think about the thyroid, but we also think about your sugar levels as well. Those of you who don't know or who may not, or may be at risk of it, may have a condition like diabetes, which is where you have too much sugar in your bloodstream. And if this is undiagnosed, then it can make you feel very tired and lethargic as well. All right, so what can be done? It goes without saying that if any of this rings true to yourselves, if any of these symptoms ring a bell with you and you think, okay, you know what, I am feeling a bit tired, maybe I should do something about this, please, please, please go and see your medical doctor. This video is purely for educational purposes only and will not serve for any individual medical advice. However, if you do experience any of these symptoms, or if you're particularly concerned yourself, make sure you see your doctor, because once your doctor has gone through your examination and your history taking, they may then order some blood tests. And this may be things to check for celiac disease, for iron levels, for B12 levels, for pregnancy markers, for your thyroid, etc. So there's lots of things that can be done to make sure that we're not missing a diagnosis. Now, if your doctor comes back and says, look, everything is looking really nice and normal, you're looking really healthy, congratulations, I just want you to go and work on your lifestyle factors, then this is something that we should all proactively look into. I often recommend to my patients that if we've not found any reasons why they might be feeling tired, that we have a look at their surrounding lifestyle factors. What do I mean by this? Well, I mean by looking at your diet, making sure that you're eating a healthy, balanced diet, making sure that you're avoiding all of those sugary processed foods, making sure that you're not having many fizzy drinks in your diet as well, and also making sure that you are engaging in active participation of exercise. Now, this doesn't have to be anything major, and all I usually say to most of my patients is having 5 days a week where you at least get a little bit out of breath for 30 minutes. But be sure to speak with your own medical doctor about your own personalised physical exercise. But if you have a nice balanced lifestyle and you're not too sedentary and you're not kind of eating all the bad foods, then hopefully you should notice an improvement in your symptoms. Last one, guys, I'm going to reiterate this point one more time. Your family doctor. Your doctor is there to help you. Your doctor is there to help you to be the best version of yourself. So if you do feel like something's not quite right, or if you're not sleeping well, or if you think there's something just gone amiss, it's definitely worthwhile speaking to your own family doctor. Well, guys, I hope you've enjoyed this video and found it useful. And of course, if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy. Depressed. So if you think that you fall into one of these groups, it's super important to have a chat to your medical doctor.